Looking at question 21, it explains that pulse wave Doppler is being applied to the pulmonary vein. In this way, the question is asking about a factor that is not related. You can consider C as the correct answer. Normally, when Doppler is applied, the presence of systole, diastole, and atrial contraction, these three components appearing in the Doppler spectrum, indicates a normal waveform of the pulmonary vein. Let's take a look at the related video. As you can see in the video, the first waveform that appears like this is the systolic phase. Sometimes, this part is further divided and analyzed as S1 and S2. Next, there is the diastolic waveform. Lastly, please also note that when the left atrium contracts, there is a waveform that flows in the opposite direction. Let's move on to the next question. This question is asking about why the pulmonary veins are not clearly visible in the apical four-chamber view. There are a total of 4 pulmonary veins. Among these, the right lower pulmonary vein is typically not well visualized in this view. Rather than giving a separate explanation, it would be best to simply memorize this information and review the content. Let's move on to the next question. This question is asking about the location where the eustachian valve appears. The eustachian valve is considered a normal variant that appears in the right atrium. In addition to this, various other normal variants can also be seen in the right atrium. It's important not to mistake these normal variants for other tumorous structures or pathological findings. Let's review and summarize by solving a few questions together. The structure you see here is the eustachian valve. Inside the right atrium, you can see substances displaying echoes like this. If you perform a transesophageal echocardiogram, you can observe this structure in more detail. This structure is observed at the point where the inferior vena cava enters the right atrium. If you see this kind of shape in the right atrium, you can consider it to be related to the eustachian valve. Next is the Chiari network. This is also one of the representative normal variants that appear in the right atrium. While the eustachian valve I showed you earlier has a rather simple structure, the Chiari network, on the other hand, appears in a more reticular form. This is the difference between them. The correct answer is likewise to choose option A. Let's take a look at the related video as well. As you can see in the video, inside the right atrium, you can observe appearances like this, almost as if a heat haze is rising. Next, if you look to the side, you can also see in the video that these parts gather together and can be mistaken for a tumorous structure. So, basically, if you see any substance appearing in the right atrium, you can initially assume that it is a normal variation. After that, you can consider that additional mass evaluation will be carried out. Let's move on and look at the next question. The crista terminalis is also an anatomical structure that appears in the right atrium. I'll provide additional explanations while watching the related video footage. Yes, in the case of the crista terminalis, it can be considered a muscular ridge that divides the right atrium into anterior and posterior parts. If this kind of structure is prominently formed, it can appear like this on imaging. As explained earlier, structures like the eustachian valve, Chiari network, and crista terminalis are normal variants that can be found inside the right atrium. Since these are fundamentally normal anatomical structures, you should first consider the possibility of a normal variant rather than immediately diagnosing them as a disease. That concludes our review of the questions. We'll continue with the remaining content in the next session. See you next time. Thank you.